Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Let's Medicine. This is the part 2 of the Norma Basalis series. इस वीडियो में हम middle 2/3 of the Norma Basalis को discuss करेंगे. जैसा कि we already know that the middle 1/3 of the Norma Basalis extends from the posterior free margin of the palate or the hard palate anteriorly, and posteriorly it is demarcated by an imaginary line जो कि anterior aspect of foramen magnum को cross करती है. So this is the portion that is included in the middle 1/3 of the Norma Basalis. Now coming towards the bony features and landmarks, so the middle 1/3 portion जो है that can be easily divided into two parts. इस तरह हम इसको easily understand कर सकते हैं. The middle portion और the central median part, ठीक है, जो कि यहाँ पे लाई करता है, एंड द लैटरल एस्पेक्ट और द लैटरल पोर्शंस. तो हम मिडल पोर्शन को डिस्कस करने के लिए उसको दो पार्ट्स में डिवाइड करते हैं. एक इसका मिडल पार्ट है, दैट इज द सेंट्रल मीडियन पार्ट, एंड टू लैटरल एस्पेक्ट्स और टू लैटरल पार्ट्स. तो सबसे पहले वी विल टॉक अबाउट द सेंट्रल मीडियन पोर्शन ऑफ द मिडल 1/3 ऑफ नॉर्मा बेसालिस. इफ यू नोटिस इन द सेंट्रल पार्ट और द मीडियन पार्ट, यहाँ पे आपको एपर्चर्स नजर आएंगे. These are actually known as the posterior nasal apertures. These nasal apertures are divided into right and left by a thin plate at the center, and this plate is known as the vomer bone. This is the vomer bone. इसके बीच में आपके पास एक thin perpendicular सी plate है that basically forms the major bulk or major portion of the nasal septum, and on both sides अगर आप यहाँ पे notice करें तो इस vomer bone से दोनों sides पे thin plates विंग लाइक स्ट्रक्चर्स जो है वो बेस की तरफ एक्सटेंड कर रहे हैं. दीज आर नोन एज द एले ऑफ द वूमर. नाउ लुकिंग जस्ट पोस्टीरियर टू द वूमर बोन, यहाँ पे हमें एक वेज लाइक हार्ड बोनी स्ट्रक्चर नजर आता है. दिस बोनी पार्ट इज बेसिकली फॉर्म्ड बाय टू बोन्स, द स्फिनॉइड बोन एंड द ऑक्सिपिटल बोन. जो स्फिनॉइड बोन है उसका जो बॉडी का पोर्शन है दैट फॉर्म द एंटीरियर एस्पेक्ट ऑफ दिस प्रोसेस, and the posterior aspect is formed by the basilar part of the occipital bone that is known as the basi-occiput. Anteriorly here, the body of sphenoid or the rostrum of sphenoid articulates with the alae of the vomer. Now coming towards the lateral aspect of the median portion, यहाँ पे अगर आप notice करें तो ये जो medial pterygoid plates हैं, they give some processes here on each side. This big process is known as the vaginal process of the medial pterygoid plates. Posteriorly, the palatine bone give process that is known as the sphenoidal process of the palatine bone. So basically what happens that the vaginal process of the medial pterygoid plates, they articulate with the alae of the vomer here, and posteriorly they articulate with the sphenoidal process of the palatine bone. So the space which is created between the palatine bone and the vaginal process, that space or that foramen, basically it is known as the palatovaginal foramen or palatovaginal canal. And through that canal, the pharyngeal branches of the pterygopalatine ganglia passes. Anteriorly, जहाँ पे आपके पास vaginal process और vomer articulate करते हैं, यहाँ पे अगर आप notice करें तो हमें anteriorly कुछ canal नजर आ रहे हैं. This is known as the vomerovaginal canal. Now coming towards the lateral aspect of the middle 1/3 portion, तो जो lateral portion है that is basically formed by two major bones. One is the sphenoid bone and the other is the temporal bone. जो sphenoid bone है उसके दो parts यहाँ पे visible हैं. One is the pterygoid plate and the other is the greater wing of sphenoid here. जो pterygoid plate है that can be divided into two parts, the medial pterygoid plate that lies medially and the lateral pterygoid plate. The medial pterygoid plate and lateral pterygoid plate, they both enclose a space in between them, and the space or the depression like fossa is known as the pterygoid fossa. That is basically present in between the medial and the lateral pterygoid plates. अगर आप यहाँ पे गौर करें तो जो medial pterygoid plate है वो just near to the body of sphenoid यहाँ पे एक triangular सा depression या space बनाती है, and that depression that is formed by the medial pterygoid plate only is known as the scaphoid fossa. Now coming towards the greater wing of sphenoid, तो जो ग्रेटर विंग ऑफ फिनॉइड है यहाँ पे, इट बेसिकली फॉर्म्स द रूफ ऑफ द इंफ्राटेम्पोरल फोसा and the lateral pterygoid plate basically forms the lateral border of or lateral wall of the infratemporal fossa. These two parts, they can be easily visualized on the in the norma lateralis of the skull. Here we have the lateralis view of the skull. So just below the zygoma or zygomatic arch, we have the infratemporal fossa. So here the greater wing of phenoid forms the roof and the lateral pterygoid plate basically, and the lateral pterygoid plate forms the lateral aspect or the lateral wall of the infratemporal fossa. Now coming towards the temporal part, so there are three parts or three basic there are three parts of the temporal bone that are involved in the middle 1/3 portion of the Norma Basalis. One is this triangular like portion. This is known as the petrous part of the temporal bone. So the inferior part of the petrous temporal bone is involved. Then we have the squamous part of the temporal bone. And then we have the tympanic part of the temporal bone here. This is the tympanic part. This is the squamous part. And this is the petrous part. The greater wing of phenoid and the petrous part of temporal bone, where they join together, a space or a fissure is created, and this is known as the sulcus tubae. This space or fissure basically transmits the cartilaginous part of the eustachian tube. Just on the posterior aspect of the greater wing of phenoid here, you can see two foramina. One is a larger and oval shaped and lying anteriorly, and the other is laterally, posteriorly and small. The larger one is known as the foramen ovale, and posterior to it we have this smaller foramen that is known as the foramen spinosum. This petrous part of temporal bone, its anterior part is triangular and pointed, and this is known as the apex of the petrous part, and this is the base of the petrous part. ये जो apex है यहाँ पे, it basically where it joins together or where it is near to the body of this phenoid, a space or a foramen is created. It is an irregular foramen, and this is known as the foramen lacerum. So the foramen lacerum is present between the petrous part of temporal bone and the body of phenoid. Now coming towards the squamous part of temporal bone. The squamous part of temporal bone here, it has a fossa or a depression-like cavity. This is basically known as the mandibular fossa, and this is the point where the condylar process of the mandible, the head of the condylar process of the mandible, जो कि हमने mandible की वीडियो में बहुत डिटेल्ड में डिस्कस किया था, that basically articulates here in the mandibular fossa, and this articulation is known as the temporomandibular joint or TMJ. इस मैंडिबुलर फोसा के बिल्कुल एंटीरियरली यहाँ पे आपको एक टुबर्कल नजर आएगा, एंड दिस इज नोन एज द आर्टिकुलर टुबर्कल. नाउ कमिंग टुवर्ड्स द टिम्पैनिक प्लेट और द टिम्पैनिक पार्ट ऑफ टेम्पोरल बोन, ये आपके पास एक ट्राइंगुलर शेप प्लेट है. द स्पेस दैट इज प्रेजेंट बिटवीन द स्क्वैमस पार्ट ऑफ टेम्पोरल बोन एंड द टिम्पैनिक प्लेट इज नोन एज हेयर दिस फिशर लाइक स्ट्रक्चर. जो ये पतली सी एक लाइन नजर आ रही है, दिस इज नोन एज द स्क्वामोटिम्पैनिक फिशर, और इससे कॉर्डा टिम्पैनाई जो है वो पास करता है. नाउ यू कैन सी हेयर दैट टुवर्ड्स द बेस ऑफ द पेट्रस पार्ट, यहाँ पे आपको एक कैनाल नजर आएगा. दिस इज नोन एज द कैरोटिड कैनाल. जो कैरोटिड कैनाल है, दैट बेसिकली इट इज इन कम्युनिकेशन विद द फोरामेन लासरम. So this was all about the middle 1/3 portion of the Norma Basalis, जिसको हमने दो parts में divide किया. One was the central median part, and then we have two lateral portions. Centrally हमारे पास boomer bone थी anteriorly. Then we had the body of phenoid and the basilar part of the occipital bone. And laterally we had greater wing of phenoid and the pterygoid plates, and the squamous part of temporal bone, the petrous part of temporal bone, and the tympanic part of the temporal bone. So thank you for watching. Now we will meet in the next video.